In 1969, while serving in the United States Army, Richard Nickel was involved in a helicopter crash in which he sustained trauma to the left side of his head. Following the accident, Nickel experienced, among other symptoms, severe head and ear pains. By the time of his discharge from the Army in 1971, Nickel's symptoms had developed into a constant ringing in his left ear, some left side hearing loss, occasional loss of balance, and chronic drainage and infections of the left ear. Following his discharge from the Army, Nickel began receiving treatment for his ear problems at the Veterans Administration hospitals. In 1971, a tube was inserted in Nickel's left ear, and in February and May of 1972, Nickel underwent audiometric exams for left ear hearing loss. In April 1972, Dr. Deal at the Togus VA hospital diagnosed Nickel's ear condition as fluid in the middle ear. The doctor did not take x-rays of the ear or prescribe antibiotics. In 1974, Nickel underwent treatment for left ear drainage and again saw Dr. Deal. In 1977, after another examination by Dr. Deal, Nickel's condition was diagnosed as an infection of the external ear canal caused by irritation due to cleaning. In 1977, Nickel also visited a non-VA physician, Dr. McGill, for a hearing exam and audiogram. Dr. McGill concluded that Nickel was suffering profound hearing loss in his left ear dating back to the accident in 1969, but indicated that he did not feel exploratory surgery was warranted. Dr. McGill gave no other suggestions for treatment. During 1980, Nickel saw Dr. Deal 5 times, complaining of severe left ear pain, bleeding from the ear, dizziness, and some loss of balance. Although Dr. Deal prescribed ampicillin, after one visit, his basic advice was that he perceived no medication or surgery could relieve Nickel's symptoms. In October 1980, Nickel saw a new doctor, Dr. Bruce Tremblay, for the first time. Tremblay took a comprehensive history of Nickel's symptoms, noting that one of Nickel's complaints, numbness in the left side of the face, had become more prominent in the last year or so. Based on his examination, Tremblay hypothesized that Nickel's problems could be the result of a chronic infection at the site of a skull fracture incurred in the helicopter crash and from a cholesteatoma resulting from that infection. Tremblay scheduled Nickel for x-rays and other tests to determine or test his diagnosis. The x-rays and tests confirmed the diagnosis, and Nickel underwent surgical removal of the cholesteatoma and repair of the injury site. Following surgery and administration of antibiotics, Nickel's ear condition improved significantly. In December 1981, Nichols filed a federal Tort Claims Act claiming that the VA doctors had acted negligently in misdiagnosing and mistreating his injury. Receiving no relief from the government under the administrative claim, Nichols filed suit in federal court in October 1982. The government moved for summary judgment on the ground that the complaint was barred by the 2-year statute of limitations applicable to actions under the FTCA. The district court granted the government's motion, finding that United States versus Kubrick 444 U.S. 111 mandated that result. This appeal followed. The statute of limitations applicable to the FTCA provides that a tort claim against the United States shall be forever barred unless it is presented in writing to the appropriate federal agency within 2 years after such crime accrues. In a suit alleging medical malpractice, the claim accrues when a plaintiff discovers, or in the exercise of reasonable diligence, should have discovered the existence and cause of his injury. The district court concluded that once Nickel was aware that the treatment being administered to him by the VA doctors was not aiding him, he was put sufficiently on notice to begin the running of the statute of limitations as required. Thus, under this view, Nickel's cause of action accrued as early as 1977, when Nickel had voiced complaints about the treatment he was receiving at the VA facilities. We do not believe that this is the proper perspective through which to view this case. The plaintiff knew that he had an infected femur, and that 6 weeks after surgery for the infection, he had ear ringing and hearing loss.